Hello, everyone, and thanks for joining. IMO welcomes you to our webinar, Clean Up the Clutter, Simplify Problemless Management. My name is Courtney Scott, and I'm a part of the marketing team here at IMO, and will be your moderator for today's webinar. Before we get started, I want to take care of a few items for those attending. First off, the webinar is being recorded and will be available for future viewing. At the end of the webinar, we will provide you with information on how to access the recording in the future. All attendees will be in listen-only mode throughout the presentation, so if you have any questions while presenters are speaking, please type those into the Q&A section on your Zoom console. We will be holding all questions until the end of the webinar for our live Q&A session. This is where presenters will be answering your questions aloud. We'll get to as many questions as we can, but if for any reason your question is not addressed, someone will follow up with you once the webinar is over. We like to keep things interactive and get your feedback, so throughout the webinar, we will be launching poll questions. I'll let you know when a poll is launched on your screen, so during those times, please take a moment to quickly select your answer. Today, we have a few presenters from the IMO team, including Dr. Stephen Rube, Vice President, Customer Experience, as well as David Arco, Product Manager. Both will be available during the live Q&A session at the end of the presentation. Again, like I said, if you have any questions while presenters are speaking, go ahead and enter those in the Q&A section of your Zoom console. With all that being said, I'd like to pass it over to Dr. Stephen Rube.
Well, hello and good afternoon or good morning, depending on your time zone. Today, as we said, we're going to be speaking for the most part about our offering known as the Intelligent Problem List. I did want to start with a little introductory information about IMO. Most of you are very familiar with us, but I put up this slide really to demonstrate the fact that IMO has really become the standard for clinical interface terminology, particularly throughout the United States. And this is very important as it relates to the problem list as incoming data comes to your EHR or to your institution, or there are clinicians adding data. It's very important that you're able to normalize that data across all platforms. And it really is by IMO's clinical interface terminology and our unique identifiers that people are able to assure that as we move this data incoming into your problem list, that we don't lose any clinical fidelity or any of the important code maps that you become familiar with and associate with IMO. So the point of that slide is really to demonstrate that regardless of the platform or the institution, we can assure that as we move this data around, it stays consistent. We're going to turn it back to Courtney for a poll question real quickly.
Thank you, Dr. Rube. At this time, everyone, the first poll question is launched. The question being, are you familiar with the features and benefits of IPL? Please take a moment to select your answer. Okay, I'll be closing out the first poll question for today and passing it back to Dr. Rube.
Well, thank you very much. All right, so why are we here? Let's talk about the Intelligent Problem List. Anybody who Googles problem list and EHR together today will find many articles discussing the problem with the problem list. The source for these problems are really many. It's the ease with which we add in an automated fashion data to the problem list. It's the time crunch that people are in because problem lists are difficult to consume because they've become so long that it becomes easier for clinicians to just add another problem than to really scan a list of 100 problems and see if the issue is already there. So we're not going to spend a lot of time, but really, what is wrong with a problem list that is not, in an orderly fashion and easy to consume quickly? They're just difficult to process. In the old days, the paper face sheets, a doctor could very quickly, in 30 seconds, get a picture of the patient and have a fairly clear idea of what was going on. These lists are very difficult to point out. It would be hard to pull out from this list on the right the musculoskeletal or the mental health or the ENT problems. So getting that rapid overall picture is very difficult. We don't like to play the patient safety card that often, but in this case, I think it's valid. Important problems get obscured in a list like the one you're looking at, and you might not see an important problem like chemotherapy-induced thrombocytopenia, a very important problem that needs to be at the forefront of what people are examining before they take care of this patient. And then at the end of our talk, we're going to talk about, tools to provide cleanup and what we can do to assist frontline people in cleaning up problem lists. I firmly believe that no one's really against cleaning up the list, is that we haven't done our job in giving them tools to make it easy and efficient in cleaning up these lists. And clinicians, whether it's doctors, nurses, therapists, extenders, are very busy. And with not clear ownership of the problem list, it's difficult to ask any one of them to take the time to clean it up. The other issue becomes with cleanup is quickly identifying the problem. So not only chronic fatigue being on there twice, but various back pain diagnoses all relating to each other, and which is the most appropriate to decrease clutter on the list. So just to sum up real quickly, the rapid identification of problems, getting back to problem-oriented the medical record. Those of you who are fans of Dr. Weed understand the need to get back to the problem-oriented medical record. We can reduce administrative costs. Many institutions are employing full-time staff to clean up the problem list, to get rid of the clutter, to make sure their data is clean and normalized across all the platforms. Hopefully we can reduce the burden on that staff. And once again, we realize that this solution is not just for physicians, but many others touch the chart often more than doctors do. So whether it's nurses, physician extenders, therapists, and so on, anyone who has frontline contact with a patient needs to have a valid problem list. This solution is not brand new. It's something that we have out there in over 300 clients with in a different EHR line that we support. So it's not new in concept, it's just new to this community. So let's take that same problem list that we were looking at a few slides ago. We have it up on the left, and what happens when we run it through our engine is that all of those problems end up in very neat categories. And people may, at first say, okay, well, we have categories, we've seen categories, that's great. Why are your categories different? Well, first of all, we have more of them. And that's not just that more is better, but we created them specifically to deal with problems that other system sorts were having, such as encounter types or illnesses that don't fall into any one body system, if you will. So what we did was we took the approach of what clinician would be most likely to be taking care of a patient with this particular problem. So if you think about that for a moment, we realized that there may be disagreements on where certain problems can end up, but we did at least have a clinical approach to where we would put certain problems so that clinically it made sense to people using this. It means there's very little training involved. We utilize the Epic architecture for the body system sort. We just have better categories. Epic's aware of that. We work closely with them in developing this solution. And Epic's body system sort that was out there was meant to be something as a jumping off point, and we were able to go from there and create these 30 or so clinical categories. So now when I say, what are the 6 problems on the left, you see they're very easily identified in the sorted problem list on the right. Similarly, for cardiac and vasculature, if I said find those 4 problems on the left, it might be difficult. Whereas with our sorting system, they all end up neatly into a single category. What were some of the problems we were hearing from the Epic community was that with the body system sort on, many of the problems ended up in the other or miscellaneous category. I'm not sure why some of these went there. They have tighter constraints on how they build their groups. But to have that many things end up in the other category really defeats the purpose of sorting it in the first place. This is a real problem list, and when we took this actual problem list and ran it through our engine, we took every one of those items in the other category and they ended up in an appropriate clinical category in the intelligent problem list. So right off the bat, better categories, they make more sense clinically, and we're able to sort essentially every IMO description for problem that you would have. So no more of the other problem, as we say. Why not SNOMED or ICD? A very good question. ICD, most people don't argue about. That really wasn't designed to be a clinical documentation system or a sorting system. It's more for classification of disease. But why not SNOMED? Well, if we look at the list that we have there, we have 2 problems in the IMO category of lipid and lipid management. That by itself is a new category that we've introduced. The first problem, hyperlipidemia, as you see at the bottom, both SNOMED and ICD have a term for it, not a problem. The second one, however, patient non-compliant with statin medication. Many of you will recognize that as a response to some of the meaningful use CQM reporting. Why aren't you having this person with high cholesterol on a statin medication? It's important to document why. Well, if you look at the SNOMED and ICD description, you'll see that non-compliance with medication regimen is really the closest either one of those two codes that can come. That would not put it in a lipid category. So therefore, that's a reason, that's just one example of why ICD and particularly SNOMED, which are very, very good at what they do, but they were not meant to do this. So the first thing we did was we categorized the problems, and we've shown that to you. And what did we see? With it, before we introduced any tools to help people clean up the problem list, we really just introduced the categories. We saw a natural decrease of 163% in duplicates on the problem list. Duplicates that were set to either resolve or deleted because they were duplicates. That was, once again, no official email campaign, no instructions what to do. But we found that the physicians who saw their category and saw redundancy in their category took a few minutes to clean up their section of the list. What we also saw is that the list stayed clean. So we saw a 37% decrease in duplicates being added. So no longer was it a problem saying, I'm not going to scan the list to see if heart failure is on there. I'm just going to add it again. It was very clear to check the cardiac section of the problem list and determine whether or not a problem needed to be re-added. So that was extremely exciting results that we saw. And once again, that was before we released any of the tools that you're about to see to help clinicians clean up the list. What else did we see? In one of our test partner organizations, we released IPL to a group of 55 physicians. Again, no big email campaign to the rest of the staff, no instructions on what these 55 physicians should do as far as their colleagues go. Yet they did recommend it, and by the end of a 3-month period, that number had grown to 182 physicians. And once they were on it, 99.8% of these clinicians stayed with IPL as their default mode. And nothing is a more ringing endorsement than releasing it in a live environment without a lot of fanfare, having people accept it and then stay with it. So we were, again, very, very pleased to see these results. So to sum up real quickly, and this slide may be a little bit dated because the items that we have listed as early adoption are practically available at this time. So although they're not completely in general release, we'll keep them labeled this way for now, but this is not something that we're thinking about doing. This is stuff that's done and is going to be available out there. But what have we done so far? What have we talked about? We talked about the ability to categorize and normalize problems. Make sure you can move your data around and make sure that someone could look at a list and very quickly be able to absorb the content. But we heard loud and clear from the communities out there, not just the Epic community, but really the entire clinical community, that tools were needed to assist or make suggestions about how to clean up the problem list in a very efficient way. Now at IMO, we don't like to do things in a hidden way as far as making terms disappear automatically. So our approach is really to make suggestions to the clinicians, but allow them to take action very, very quickly. What are the 3 areas we divided them up into? The first one is problems that have a natural time course associated with them. For example, pregnancy. As far as I remember from medical school, it should last about 9 months. So someone who's been pregnant for 2 years on the problem list, it's probably an expired diagnosis. A fracture without complication should last 6 to 8 weeks. Acute infections that last 6 months probably should not be categorized as acute anymore. So the idea of descriptions or diagnoses that should have lapsed out on their own, could we present these to the clinician in a way to resolve them? The next one, duplicates. You might say, well, duplicates are pretty easy. If you see UTI and UTI, it's a duplicate, get rid of one. It's actually not that easy because, as you'll see, there's what we call conceptual duplicates like Lou Gehrig's disease and ALS, which may not be obvious right off the bat that they are duplicates, but they are conceptual duplicates. The last category is really where we had the most feedback from people, and that was the desire to find problems that are not the same exactly, but they're either related to each other or evolutions of the same problem. For example, left-sided back pain becoming left-sided back pain and with sciatica, becoming left-sided back pain with foot drop. These are all evolutions of the same clinical condition, yet very, very different descriptions with different codes associated with them. Can we somehow present them so that a clinician can pick the one that's most relevant? I'm going to turn it over for another poll question.
Thank you, Dr. Rube. At this time, the second poll question is launched. Which of the following is your biggest problem list pain point? And for this question, please select all that apply. The answer selections are duplicative and outdated records, takes too long to review, pertinent problems hard to find or overlooked, all of the above, or other. All right, thanks to those who took the time to answer. At this time, I will be passing it over to David Arco.
Thanks, Courtney. All right, before we hop into a demonstration, just a couple things about where this product came from, some background on where it came from, our work with Epic on integrating it into the Epic EHR, and then we'll get into some screenshots and a wireframe click-through so you can see what the workflow looks like. So as Dr. Rube mentioned, we see IPL, a lot of you know IPL right now as a way to categorize, organize, and better view your problem list. And while that's great, and that was certainly an important need, we see the problem list as our solution to the problem list being larger than that. We realized that we first needed to make the problem list usable. So we categorized and made it easier for a provider to interact with it. But the next thing we realized we needed to do was clean up the clutter that existed on that problem list. So we set out to create this service, IPL Clean. It's a web service that we are integrating into Epic using Epic's Smart on Fire integration, as well as some of their interconnect APIs. And there are a couple of pieces involved in this. Let's take a look at what it actually looks like in the EHR. The first piece is a best practice alert that will allow that patient's problem list to be sent to IMO, so we can run it against this cleanup service and identify those sources of clutter that Dr. Rube itemized earlier: the lapse problems, duplicate problems, and related problems. Once we identify whether there are any of those there, if there are, and we see a problem or problems flagged, we can return an alert to Epic and fire a best practice alert that will alert the provider to the presence of cleanup opportunities. That best practice alert is a passive alert, and it is the lowest level, a suggestion level, so that it is not intrusive, not in the provider's space, and does not appear to be a critical issue, because we're certainly sensitive to alert fatigue and don't want to introduce that ourselves. But we do want the provider to know that they do have an opportunity to clean up the list and make that thing more usable. So the BPA will fire, tell the provider that that opportunity is there, and then from the plan navigator, where, as you can see, you have the categorized problem list, although that is Epic's categories, not ours, because this came from an Epic system. But you'll have IPL in the problem list, and then right under that, you'll have the ability to launch our app, which will launch in the sidebar. We went back and forth on how we wanted to launch this app, where it would appear in the EHR, and the sidebar made the most sense because it still allows access to the patient's problem list. So if you want to navigate to see any metadata, overview, notes, orders, any other sort of data associated with that problem, you can go back to the problem list and the plan navigator and research that data so you can make those decisions on how to clean up the problem list in the sidebar. So that was a big win for us. You can resize the problem list, and this screenshot came from our test integration with Epic. So this has actually been integrated both in an Epic environment and with a pilot customer. Since doing this integration, we've gone back to do some refinement on the UI to make sure it fits in that spot so it looks a little cleaner than what you'll see here. But you can expand that. There is responsive design in our app, so it'll size appropriately and optimally, so you can see as much information as possible. And we'll get into a little more of the elements of that in a second. This is just here for reference, so you know where that app will live. All right, this is the first category of clutter we're looking for, the lapse problems that Dr. Rube spoke to earlier. The next will be the duplicates, those exact duplicates or conceptual duplicates. And the last one, related problems, those problems that might be slightly different and actually are really hard to find because they have different mappings to SNOMED ICD, but they are related enough that they are similar and likely are talking about the same condition, just in different levels of specificity.
So real quickly, as David goes through this, keep in mind that although our best practice recommendation and hope is that clinicians will go through all 3 steps of these by clicking next, they can't exit this workflow at any time by clicking done. So if they just want to, they're in a hurry and they deal with just the lapsed category, that will be saved and they can exit out of that. Thanks, Dave.
Yep. And as you see on the right side is the full problem list with our clinical categories applied to it. And this is here for reference so that in the app, you can see the actions that you're taking to clean it up. When we get into the wireframe, you'll be able to see, you'll see that in action. All right, quick question before we run over to a demo.
Thanks, David. At this time, we've launched our 3rd poll question for today. Does your institution employ full-time or part-time help to assist in cleaning up a problem list? All right, at this time, I'll be closing out that poll and passing it back to David Arco.
Thanks, Courtney. And here we'll get into a quick demonstration of what the workflow looks like. While this is an early wireframe that was built on before we decided to move into the sidebar of the Plan Navigator, but essentially when you will be able to launch the app, and this would pop up in the sidebar. You can pull it out to the full screen if you would like. You'll again, it will refactor nicely so you can see optimally the information that's available in the app. On the left side, you'll have summaries of cleanup opportunities. This is a very nasty list, so you'll see lots of stuff. Some of these categories might not be represented, and you'll be able to skip right over those. If you don't want to dig into something that might look particularly hairy, you can certainly exit out at any time. On the right, again, you'll have the full list, so you can work through that. You'll also see indicators here for HCCs. We know that that's a big focus for a lot of our clients, so we make that visible with this indicator, and this will also come into play on the left side as you're doing your cleanup. All right, so here in the last section, these are, again, those time-limited problems that, based on their onset date, are likely no longer active. So these are likely going to be a quick scan and get these off my list as quickly as possible. So we have a check all function here. So you can quickly resolve all those problems and then move on with your day. What you see here is options to resolve or delete the problem. We have since introduced a resolve to past medical history. If you'd like to keep a record of one of these problems in your past medical history, you can select that option, and it will send a record of those resolved problems there. And as I check those off and resolve those problems, on the right side on our intelligent problem list, you can see those problems that were resolved are grayed out, have an indication here on the action that was taken to them. So you can keep track of your work on our problem list as you're doing your cleanup. On to the next section, our duplicates. All right, again, here we're looking for not just exact duplicates, but also conceptual duplicates, or what you might call synonyms, such as ALS and Lou Gehrig disease. You, again, can delete the one that you do not want to keep. If you want to get into the details of any of these, you can go over to the Plan Navigator, which is obscured here, but with the app in the sidebar, you would have access to the Plan Navigator to see any notes. But you can also get into notes here. So within our app, you can visualize the notes if that helps you make a decision about which one you'd rather keep. All right, we'll just cruise through these real quickly. Excuse my wireframe, it's not as responsive as our app is, unfortunately. But you can see that the indicator here is a little bit different when I deleted something. I get a strike through, and again, on the right, I have it tells me that I'm deleting that problem rather than resolve. Now on to related. This is where it gets a bit more interesting. This is much harder for a programmatic dupe check to find, because you can't just say, show me all of the matching SNOMED codes, or show me all the matching descriptions, or even the matching ICD-10 codes, because even though this first group are all related to kidney disease, they all have different ICD codes. So it'd be real difficult to be able to say programmatically, yeah, these are all related. But IMO can. We understand the relationships between our terms, and all of your problem lists are full of IMO terms right now. You're all problem IT users, so your content is all IMO-ified already. So we can look at those problems and know this is related to this, whether it's through our ICD-10 modifier hierarchy or through the SNOMED mapping. We have a number of heuristics to try to find these relationships and group them up and call them out so that you can make these decisions, because these four problems are all really talking about the same condition, just in different levels of specificity. And this is very important because it might have an impact on your reimbursement. Some of these are HCCs. If I document the staging of the CKD, I'm likely to bump myself into an HCC category that has huge impacts to reimbursement. Whereas if you have an uncategorized list, it's quite possible that a provider is going to select a diagnosis that is not as fully specified and is not an HCC, and you're going to lose out on that risk adjustment. So again, I'm just going to work through here and get rid of the ones that I don't want. We will have an indicator over here to tell you the work that's being done, what's going to happen to your problem list when you finish. All right, and now I am done. Hit next. I'm back to the relapse. Okay, so now there's one last step. We need to review this. Before you can exit the app, we want you to review the work that you've done. And then once you have viewed everything, then you can click done and then move on. And then these changes will be submitted to Epic. If you refresh the Plan Navigator, now your problem list is going to be nice and concise and no longer have those duplicates that I was previously seeing. So now, why did we bother to do this? If in Dr. Rube's slide earlier, he showed you that one of our early adopters, when we looked at their data after they went live, we noticed a huge uptick in cleanup opportunity or cleanup actions being taken on their problem list. So if clinical categories were already supporting problem list cleanup, then why would we bother building an app that was going to essentially did the same function? Well, problem list clutter is really more than just an annoyance for the provider. Dr. Rube, being a former doc, is very focused on the provider angle of things.
Still a doc.
Yeah, okay. It's very focused on how it affects him, right? And when he's seeing a patient, what does this mean if this problem list is messy? Well, the problem list is really central to a lot of other things in the EHR. One provider called it the most essential, or one CMIO called it the most essential 2-minute communicator, 30-second communication tool that nobody uses. And that's really true. And that's just because, as Dr. Rue mentioned, the tools aren't there to allow them to manage it properly. But In addition to that, it drives all kinds of other stuff in the EHR, whether it's clinical decision support or best practice alerts or your population health initiatives. Those all rely to some extent on the data in the problem list. And if that problem list isn't accurate, if you can't trust the data in the problem list, you can't trust your investment in the decision support tools and best practice alerts and your population health initiatives. Those outcomes are all going to be challenged because your underlying problem list is not accurate. So this is another way to lower that bar, to help for providers to actually take ownership of the problem list and manage the problem list and curate it the way they know they need to. The easier we can make that, the more likely it is it's going to happen, and then the better results you're going to have from all of those downstream workflows and decision support tools. All right, I am going to head back to, I'm going to pass control to Steve so he can get back to our slide deck.
Thanks, David. I did want to clarify something. I'm seeing some of the questions come through before Courtney does this next poll question. Hang on one sec. There. All right. Didn't want to make you answer the same question twice. One of the things we were seeing on our questions, it was a bit confusing, so let me clarify for a moment. The sorting function of IPL, putting them into clinical categories, will be available in Epic in the native problem list. You can see it in the problem list, it will sort it. We can do that now, that's something that you could see. Yep. The cleanup function, the actual place where the cleanup tools exist, that's what exists in that sidebar application. That's where the work is done in that little applet, if you will. However, the changes that you made, as David pointed out, are then given back to Epic. So the next time you look at the Epic problem list, they are visible. Those changes are saved in the native list. So once again, categories in the native list, any work you do in the sidebar applet does get transferred to the Epic native problem list. It's just the actual actions that you take for the IPL clean are done in that sidebar app. So hopefully that clarifies that.
Thanks, Steve. All right, so when is this functionality available? Well, we are just about to, as I mentioned earlier, we've integrated this within the Epic Sandbox. We've done a pilot integration with a client who already has IPL clinical categories, and we're about to kick off an early adopter program. That early adopter program has a number of benefits for you. It would allow you to gain early access to this functionality, so you can start cleaning up your problem list right away. You can also give us some feedback on workflows, on features that you think might be helpful, and help us guide our refinement towards GA. You can lock in our current pricing and position yourself as your organization as a thought leader. We're really optimistic that this is going to be a huge success, and we look forward to taking this on the road and telling our story. And we would love our partners to be able to help us with that story. So what would we be looking for from our early adopters? A few things. Some quick surveys to understand what providers' experience with the problem list was before IPL and after. We would like to take some look at some data, so we can do a study just like we did when IPL was implemented on problem list cleanup actions. We'd like to see what kind of gains we get once we introduce an app to make that cleanup even easier. We would like, of course, you to share your story, whether it's to individual accounts that might be, or individual Epic users who might be interested in adopting the solution themselves, or on webinars or presentations or at conferences. How about timing? When will this be available?
When will this be available? Oh. I thought you wanted me to play the audio.
Yep. So the clinical categories that you saw and Dr. Rube talked about at the top of the presentation, those are available now. So you could theoretically, sign up for IPL this afternoon and have it integrated to those clinical categories integrated tomorrow. Have your providers using it by the afternoon. And then you'd start getting the gains of all of that improved organization, whether it's provider satisfaction or efficiency, or those cleanup actions that we saw happening organically just by better categorization. By signing up for IPL before December 15th, you qualify for our EA program, so you can get early access to that IPL Clean app. That's all available now. So if you are interested, please follow up with us after the webinar. We'd be happy to give you more information. The IPL Clean EA program is going to start in Q1. Just after the first of the year, we'll be rolling this out to those EA candidates. They'll get access to IPL Clean functionality, and then we'll start gathering feedback on what works, what doesn't, what needs to be tweaked, that kind of stuff. And then that EA period will last for about 3 months. We'll get that feedback from those users. We'll gather the user stories and collect some data to understand the real gains that are being recognized with this cleanup app. And then we'll make it available to all of our Epic clients. And that should start in Q2 of 2019. So I think we've got one more poll question.
Thank you, David. All right, this will be the last question related to today's webinar content. It's currently launched on your screen. Would you be interested in participating in our IPL Clean Early Adopter Program? Please take a moment to select your answer. All right, I will be closing out that poll for today and moving on to some additional resources. On your screen, currently listed are some resources that you can utilize after today's webinar. If you have any questions or feedback, you can contact the IMO sales team at sales@imo-online.com. You can also reach out to the IMO account management team at accountmanagement@imo-online.com. To the left, you will see our Epic Affiliates page information, which is where you'll access all previous webinar recordings, as well as the recording from today's webinar, and additional resources specific to Epic users. Lastly, if you're interested in becoming an early adopter, please contact the IMO sales team for more information. At this time, if everyone can start submitting your questions that you have throughout today's presentation in the Q&A section on your Zoom webinar console. If you refer to your screen, you can see where you can access the Q&A section. Once we start receiving questions, our presenters will begin answering those questions live.
Or whether the app is on demand. It is on demand. We, again, just like we don't want to throw up BPAs if they that may create kind of a false sense of urgency. We don't want to launch our app unless the provider wants to see it. So it is on demand. Again, we will be taking feedback and making minor tweaks like that as we go through the EA process, but we're pretty confident that that's the right approach here. Yeah. Another question here, is the sorted problem list only viewable in the sidebar, or will it show in the Epic problem list and the problem list activity and other places it is viewed? Yeah, the problem list that you see in the Plan Navigator is driven by IPL groupers that would be implemented as well. So you will see the same categorization in both the problem list in the Plan Navigator and the problem list that you see in our app. The problem list in our app, though, is we are able to demonstrate the actions that you have taken. It's kind of like staging. So as you indicate that you want a problem deleted or resolved or sent to past medical history, you'll see that indication on the problem list in our app. And it's also a place to confirm that information before you submit it and actually take those actions on the database. And then once those actions are taken, if you refresh the Plan Navigator, you'll see those changes applied to the problem list in Epic. But we wouldn't want to take those changes or make those changes without a provider confirming that they actually wanted to. So that's why we display the categorized list in our app as well. Question here about how much analyst work is required to set up the Clean app. Not a ton, to be quite honest. A lot of the heavy lifting is on the Epic and IMO side. With our experience with, again, we have done one pilot integration, and that integration was kind of a learning process for not just the client and IMO, but also for Epic. And so we documented that process. It is in the process of going onto Galaxy. So you'll be able to review the implementation process. But as far as analyst work, we were told that it would be right about 8 hours of analyst work. So not more than the clinical categories, which you can set up to get that better categorization in your native problem list. You can get that set up within 2 hours. All of our Epic clients who are currently using clinical categories can set those up in an afternoon. The integration of the app is a little bit more involved, but still not terribly. We've been told that end to end, the process is probably about a week, but that most of the heavy lifting, again, is on Epic and IMO.
We received a question regarding the recording and slides from today's webinar. Like I mentioned before, the recording will be posted to the Epic affiliates page, and we will also be sending out information to access the direct link for the recording as well as the webinar slides.
A question here about documentation in Epic, overview notes, etc. Whether that is visible if a problem has any of that documentation, whether it is visible in our app. Absolutely. We make that note visible in our app. We show an indicator next to any problem that does have a note. You can expand that and see it within our app. You can also head back to the Plan Navigator if you want to dive a little deeper and see if there is any other metadata or orders associated with that problem. Question here about problem list reconciliation. Great question. I understand that there's new functionality in Epic to pull in outside problems. And quite honestly, outside problems are another source of this clutter. So can we integrate this into that reconciliation workflow? Unfortunately, no, because those problems live in a separate data file, DXR, I believe. So they need to be pulled into the local file before we can access those. But any problems that get accepted will and do introduce duplicates or expired or related problems would trigger the BPA and to launch our app, and you would then be able to clean up any outside problems that get added that do introduce new duplicates.
But perhaps with enough input from the Epic community, you know, in the future, we believe that it should be available at that point as well. And with enough feedback from you guys, hopefully we could work with Epic to make that possible for you.
A question here about whether there will be an audit trail. Absolutely. So what happens to these problems when we delete or resolve them? The delete or resolve actions are the same ones that you would be using in Epic today if you were to try to clean up the problem list within within Epic. So it is absolutely tracked, the provider who takes those actions, that will be documented. And the deletes are soft deletes. So that information is still available and retrievable. It is just cleaned off the problem list view. So it is no longer taking up space and showing as active. Interesting point about Happy Together and Epic's problem list reconciliation of outside problems. Yes, there is some identification of duplicates, but those related problems are not flagged there. So it's not not quite as detailed as what you will find in our app. So the IPL Clean app will certainly support further support cleaning up those outside problems.
We currently have a lot of questions coming in. We're going to try and get to as many as we can in the next 6 minutes. And if we're not able to address your question, We will follow up with you directly after the webinar.
Question you're asking for confirmation that there will be a button for resolve and add to past medical history. Yes, absolutely. That's been added, and can we send out a screenshot along with the app or with the deck? Yeah, we'll include a screenshot of the current app in the deck and send that out. You'll be able to see there's both a resolve to past medical history and delete.
All right, at this time, everyone, we're going to be closing out our session for today. Thanks for taking the time to join, and we hope you have a great rest of your day. If any of your questions were not answered, we will be following up with you after the webinar. Thanks.